All right, so after that little musical interlude, we're back with Dr. Darren Green talking antibiotics. We had a caller on the line. We have her on the line, Natalie from Joburg this morning. Good morning.
Good morning to you.
Good morning, Natalie. What's your question?
I'd like to know, is there any other antibiotic designed for a child? The little girl who's 2 years old who refuses to take it because it tastes terrible. And is it not possible to give her an injection rather than antibiotics? At least it's a once-off thing and then it's over and done with.
Natalie, good question. I can relate. I'm sure you as well.
Okay.
Yes.
You know, like when it comes to choosing a breakfast cereal for a 2-year-old, the same applies to antibiotics. And the big catch here, obviously, is to make an antibiotic taste good, normally what's required is obviously sugar.
Yes.
And sucrose in their preparation. So there are antibiotics that taste less vile than others. Certainly, you need to have a practitioner that knows a little bit of practical experience in working with the different types, your blackcurrant flavors and so forth. But you get clavulanic acid, which is in a lot of your amoxiclavs, etc., that leaves a terrible aftertaste and actually induces vomiting in quite a few patients and makes them nauseous. But there are those that do taste better. I mean, your Oraloxes and Prozefs and that kind of thing. So be aware of the fact, firstly, that they all have different tastes. But what we do consider is the dosing schedule and the volume of the antibiotic, even more so in children. If a child has to consume for the right dose a large volume, like 10 mils in a 2-year-old, that's a lot. 10 mils for you and I is nothing.
Exactly, but it's a lot for 2-year-old.
And can make them even gag more easily, for example. So injections was the other part of the question.
Yes.
Certainly, there are broad-spectrum antibiotics that can be injected intramuscularly. It's very painful for the child, some of those injections, and certainly one also must consider the resistance profile. There are less intramuscular injections available than oral antibiotics. Intravenous is where we go next if someone's not tolerating oral antibiotics. If a child just keeps spitting it out or is vomiting so profusely that we need to administer a drip, then that's the next line. So certainly I think just consult with a practitioner that knows the options a little bit better.
All right, perfect. Dr. Darren, thank you so much. We are going to be talking about this discussion a little bit more on the other end of the break, but remember that number 083. Oh, wait, before we go, we got another call. Yes, Marie, good morning.
Hi, good morning.
Good morning. We almost caught you before we went to our ad break. All right, what's your question?
Morning.
My question to Dr. Green is, my husband is 77 and he's had 7 strokes and he's got a suprapubic catheter in. And he's on antibiotics forever. And I want to know if that is a good thing to be so long on antibiotics, or is there anything else that I can give the man?
Yeah, you mentioned a 77-year-old?
77-year-old, yes, got a catheter in.
Catheter in
as well, but he's been on antibiotics forever, she said.
Yeah, so what we have then obviously is when you need a catheter due to either enlarged prostate or bladder problems, so that you don't have urine retention, you then have obviously an increased risk of introducing an organism via the catheter into the bladder. Firstly, secondly, the chemical reaction and inflammation of the synthetic substance that's obviously inserted can also cause problems and inflammation. You get a lot of resistant bugs when it comes to bladder infections. And in elderly people, part of the problem is the obstructive lower urinary tract symptoms, where they void, but they don't empty the bladder completely. In other words, a little bit of urine stays behind in the bladder, which then acts as an environment for organisms to actually grow.
Oh, wow.
So the catheter needs to be changed regularly, firstly. A culture needs to be done on that urine to see which organism it is exactly is causing the recurrent infection, and then an antibiotic will be chosen basically based on that. Lifestyle issues, urinating more frequently, drinking lots of water. Obviously, things like cranberry juice help in preventing the organism sticking to the bladder wall. Those are practical things. And then obviously a good probiotic and also changing the pH of your urine can also help every now and again.
All right, Dr. Darren, thank you so much. We're going to be taking a quick break. We're back with Dr. Darren Green after the break. Call us 083 9133 728. We'll see you just now.